Good morning, everybody. Welcome to the VBF Facebook Live session. Today we have our guest expert, Dr. Roy Geronemus, world-renowned laser expert for the treatment of hemangiomas and port wine stains. And we also have our special guest, the VBF Global Ambassador, Scott Cupples. Today's topic is, why is it important to treat early? And I'm hoping that some of you are jumping on quick. Let me know. Oh, I see Lisa's on, so I know we're working. Thank you, Lisa, for letting us know. And before we get people, the questions coming in, Scott's going to talk a little bit about his journey, and I think it's important so that a lot of you parents making decisions about whether to treat or not can hear firsthand from someone who's lived 34 years with a port wine stain. So go ahead, Scott. You want to give us a little bit of your history?
Sure. First, I just want to thank Dr. Linda for the opportunity to have this platform, and Dr. Geronemus for doing all the treatments over the last year and a half. Basically, I don't want to get into too much detail or take a lot of time from the experts to be able to talk about this kind of stuff. But going back and just looking at growing up with the birthmark and everything, my father, he had an opportunity. He brought me in to speak to a doctor early on, and they told him that, hey, you probably should just wait till you're a teenager. So when they brought me in as a teenager, I was 12 years old. My dad asked me, he's like, hey, do you want to get your birthmark treated? And when I was 12 years old, I didn't really know the ramifications of waiting or any of that kind of stuff. So, when he asked me about it, I was kind of looking at it like, all right, do I really want to start getting treatment? Do I want to get get the lasers and have to go in with that kind of stuff? So, at the time, I decided that I wasn't going to go forward with it. But, looking back now, being a father, if my son had a vascular birthmark, I got to tell you, I would have got him treated early on, right away. And, going back, to that decision, if I could have, reversed time, I would have started getting it treated when I was 12 years old. But, really, it just goes back to right now, there's a little bit of a saying going around right here. I believe it's done by one. There's so much clearance, so much opportunity so much opportunity to get early intervention and get clearance done, earlier on in the stages of, the birthmark treatment. And, all I got to say is, as a parent, if I had the opportunity, to go back and reverse time, that I would definitely get it treated early on.
And one of the things I'd like to add, and let's start taking your questions, please, because we only have Dr. Geronemus for a limited period of time. I'd like
Linda,
to.
if I could just comment for a minute on Scott. Scott, I appreciate what you've done coming here and speaking publicly about your experience. But I think what Scott has experienced as a result of not treating is the thickening that has occurred over time. His birthmark became markedly thick and bumpy with the risk for increased bleeding. I don't know if that ever happened to you with shaving or anything like that.
Absolutely.
But I think one of the advantages of intervention is that you can minimize the thickening that would occur otherwise. And the nodularity or the bumps that Scott has on his cheek and that he developed, that we started to treat in the last year or so, really may not have occurred had he been given the opportunity to treat earlier on. That's not to say we can cure everyone or prevent this altogether. But one of the main benefits of treatment is to prevent the thickening that Scott experienced. And I don't know if, Scott, what you experienced just from the psychological point of view, but many patients do recognize that if they had less of a birthmark or didn't have a birthmark at all, then there'd be less of an issue in terms of some of the issues they deal with on a social basis.
Sure, and definitely just to piggyback on what Dr. G just said, if you go back, I shared a couple pictures earlier, and I'll probably share some afterwards. If you look at pictures when I was 5 and when I was 7 and when I was 12 years old, my son, I showed him one of the pictures of when I was 12 years old last week, and he looked at it and he said, "Daddy, you lied to me." And I was like, "What do you mean I lied to you?" He's like, "You said you had your birthmark your whole life." And I was like, "Look a little closer." And he looks a little closer and he's like, "Oh, I see it now." And he's like, "It was so much later." And, getting into my 20s and, eventually into my 30s, it grew, and I started to grow the nodules and the thickness and the darkening. And I think Dr. Linda actually noticed the military picture of me, and then from there I came in and started getting treatments from Dr. G. So
yeah, one of the things that was what I was going to add, which Dr. Geronemus talked about, was the need to get early treatment, but also when Scott was in the Middle East exposed to extreme sun, it got thicker and darker. And that's why it's really important to tell these parents about sunscreen and not letting these kids that are undergoing treatment or have a port wine stain to just sit and cook in the sun. So that was something too I wanted to bring up.
I see. Relative to what we're talking about, Aaron's has asked the question, does thickening always happen? And the answer is no, not always, but about 2/3 of the time. Usually by the age of 30 to 40, you begin to see it, and by mid to late 40s, you have that 2/3 number. Sometimes the thickening can be minimal, with little pinpoint areas of small little bumps. Other times they can become very large, so it varies from patient to patient.
And it never regresses.
Now, it doesn't regress on its own, no.
Right.
We do notice, however, that in the women, as they get older, with birth control pills or with pregnancy, there can be some exacerbation of the port wine stains as well.
So that you're saying hormones can affect them. And
oh, yes.
Yes.
No question about it.
so we talk about that as well as young girls that have extensive port wine stains avoiding birth control pill because it could make it worse. I mean,
if they need to take them for medical
Right.
reasons or
Right.
for whatever reason, I mean, that's okay, but they should be aware that there could be some thickening.
Kelly Odell
Darkening.
Luther says, good morning. Julie again says, the picture of Scott when he is young, had he had treatments? No, he's had no treatments. He never started until
No,
a year ago, 2 years
I got my
ago.
first treatment when I was 32 years old.
Yeah,
I never had a treatment when I was a child.
Right. So that's how light his port wine stain was up until went to the Middle East in his 20s and was exposed to extreme sun. Is there a difference in the thickening when the port wine stain is on the body versus the face?
Not necessarily. I've seen thickening in all parts of the body, really, but again, not for many years typically.
And when they have the little blueberries that pop and bleed, that's a sign too for early to get in and get it treated,
Oh,
right?
yes.
And you can help that with the laser.
Oh, yes. And sometimes we have to vary the laser. We use different lasers for different purposes. In Scott's case, we've actually used a second laser. We use primarily a pulse dye laser to treat the most of the birthmark, or for the thickened areas, I'll actually use a YAG laser for that purpose.
So Erica says, when you say 2/3 experience thickening, let me just get back here. Do you mean only those with port wine on the face? What is the risk of thickening bumps for the port wine that are not on the face?
I think it's the same.
Same.
Yeah, no,
Okay.
No change in risk.
All right. So please let your questions come in. Just pull it up here on my phone so that I can also help out if I get some. And I can see the questions coming in a little bit better on my phone. So we're ready to take your questions. We're here today with Scott Cupples, the VBF Global Ambassador. And if you're interested in being a Global Ambassador and helping us network the need for early treatment and accurate diagnosis, you can reach out to Scott or myself at birthmark.org/Dr. Linda or birthmark.org/Scott. And you can also reach Dr. Geronemus at birthmark.org, Dr. Geronemus. So please send your questions. We're waiting to see him. We only have Dr. Geronemus for a limited amount of time today. Scott and I will stay on the whole time. So I'm just pulling up the session. Here we are. Now, here we go. Scott and I will stay on the whole time. Yeah. But I'm just looking to see if I'm missing any questions. Ooh. Okay. So here we go. Okay. Not fully cleared, but looks really good. So she says, so you have seen that if there have been treatments when young, you are not seeing thickening or blebs. My son's port wine is similar to Scott's. He's had 6 treatments and is now 4. Not fully cleared, but looking good.
So that's a difficult answer to give because we really haven't followed patients long enough to know how they're going to look 40, 50 years later. We're not quite that old yet. But I have noticed anecdotally, without data, that those patients who've had treatments are less likely to have any issues with thickening. I wouldn't say we eliminate that risk completely, but it's less likely to happen.
So Mandy says her daughter is nonverbal and she has a large portion of the left side of her face is covered with a port wine stain. Could that be related? And she's also saying she has headaches. I mean, she could have Sturge-Weber.
Yeah, I think if you're having headaches, it's definitely worth seeing a neurologist to make sure there's nothing else that could explain that.
We now have Olga from Russia. She's saying hi to us. Hi, Olga. Thank you for joining us. She said hi to you, Scott. Erica Wilson said her daughter just turned 5. She has glaucoma and has had interventions and operations since birth. She's just begun this past year to be able to trust people. She has a hard time with anyone touching her, especially doctor's appointments. Her concern has been with her mental health and trauma. So we have not done lasering. How do we weigh the pros and cons, giving the mental health and trauma of a young child going through this?
Well, you definitely have to balance out the experience of the procedure versus the consequence of the birthmark. This is something we weigh all the time. That's one of the reasons we like to begin very early to get as much done as possible. Our present philosophy is to begin treatment, within days or weeks of birth, in an effort to get a response before the kids are aware of what they're going through. That's one of the reasons, not to mention the fact that we get a faster and more complete response when we begin early. So as they get older, if you definitely have to balance that out, many physicians have the options of doing it in the office or doing it at the hospital. If somebody's overly traumatized, that might be a situation where hospitalization or at least doing the procedure on the same day surgical basis would be the best thing to do to minimize the trauma.
Yeah, and one of the things, Erica, I'd like to suggest, we have our conference on October 6th in New York City. Dr. Geronemus will be there. And there are 30, 40 children in daycare that have birthmarks. It may be just a wonderful experience for her to meet with other kids. Our psychologist, our psychotherapist will be there. She can talk with her and with you as well. It's free. You get breakfast, lunch, and dinner. And if you're outside of the New York metropolitan area, you get free lodging. So I'd like you to consider that. And it's at birthmark.org/conference. Mandy says, does the port wine stain cause pain to the face or headaches?
Not necessarily, unless there's an underlying condition associated with the port wine stain, then there could be something neurological that needs to be evaluated. But typically the answer is no.
So Nancy says her son Alex has just had pulse dye surgery with Dr. G. He mentioned a news laser. Can he explain?
Yes. First of all, hello to Alex.
Mm-hmm.
Hi, Nancy. The company one of the companies that makes the pulse dye laser, Candela Syneron, is introducing next month the next generation pulse dye laser. It'll be called the V-Beam Prima, Prima. This has several advantages relative to what we have presently. One, it has a larger spot size. So for those patients with larger birthmarks, we can now treat with a 15 millimeter spot size relative to a 10 or 12, and some people use 7. So if you think about multiplying the radius, and you look at remember your old math, pi r squared, if your radius is squared and you double the radius, then all of a sudden your treatment becomes much faster. Mm-hmm. So from a practical basis, the treatment should be much, much easier for those patients with larger birthmarks. The other point with the new laser is that it has higher energy at the larger spot sizes. So this will be a big deal for those patients with larger birthmarks, because not only can you treat faster, but you can deliver more energy, so you should get more clearing, not just a faster treatment. There is a third component of the laser that is not yet available to the general public, something that I've been working on with the company, and that's adding radiofrequency treatment. So it's not yet going to be released commercially. I hope that will be the next round, because I do believe by adding the radiofrequency, you get even more clearing, particularly with some of those resistant port wine stains.
How long do you think it'll be before that'll be?
I don't know. That's a good question.
Another year?
The company is new. Mm-hmm. I mean, it's an old company with new ownership. Mm-hmm. So they're now reassessing what they have. And, it's my hope that the company will recognize they have a valuable asset and run with it.
Well, maybe in October when you speak at the conference, you'll have some good news.
We can hope. But I think this change that we're going to see next month will also be valuable. And it's also a more consistent treatment. There's some technical components to the machine which will allow for I think, a better treatment session per patient. Be less variability between pulses. The dye will degrade less. So from a physician's point of view and the patient's point of view, it should be a more consistent and I would think a more effective treatment.
Great. So we have a lot of questions coming in now. Megan says her daughter has a large port wine on her face. She's responded well to treatment. She's had 10 and has had she's 10 and has had 30. She had some darkening after about 9 months, so we do maintenance once a year. Should she expect to do this for life? Should we be more aggressive and do more maintenance when we see it darker?
Well, I think, you have a child, a girl at 9, I think, around puberty, she will probably experience a little more darkening because of the hormonal changes. So at that point in time, you may want to pick up the treatments a little bit. I'm hopeful with the newer technology, we won't need to rely upon maintenance treatments, but as it stands right now, for those patients who haven't cleared completely, the maintenance is something that, should be anticipated. In terms of being more aggressive, it's hard to say. One of the things that we do when we see patients who've been treated elsewhere is evaluate the parameters that have been used. And sometimes we find that patients are either undertreated, in some cases overtreated. So the treatment method does vary from physician to physician, and it's possible that there's a different way to do it.
So Kelly said her baby is 8 months old. He was already imaged for Sturge-Weber, but has no signs of it, and was wondering, should she repeat it or just watch for symptoms? Like, what do you think her plan should be?
I think it depends on where the birthmark is. Is the child at high risk for Sturge-Weber syndrome? If you have a small spot on the cheek, I would say no. If you have involvement of the forehead, eyelid, and the cheek, I would say it's probably worth repeating the imaging, but I would leave that to the neurologist.
Okay.
But certainly I would want to repeat that, after the age of 1.
Yeah, and Dr. Comey did a session with me a couple months ago, and she said like around 2 or 3 you could repeat it, and also to be aware that symptoms can present at any time in life, not just in infancy. So Goke Sam said she's from Virginia. Her daughter has had 6 treatments. She started at age 10. She's 15 now, and her port wine stain is getting darker. So does she need to start treatment again?
I would think it's getting darker. It's worth reconsidering the option for the treatment, taking a look on how things have been treated, what laser was used, how was that laser used, were the treatment sessions optimal? Is there another way to do it, or perhaps just restarting what was done before will be enough?
Okay, so Jen says her daughter's port wine covers her whole right arm, back, and chest. Her doctor has not been able to answer the question of whether she's going under general anesthesia and any long-term effects. So besides its thickening with treatment, is it reversible? And the side effects, she's saying, from anesthesia.
So this is a big debate in the medical field right now. And the FDA has issued a warning about multiple procedures performed under general anesthesia for children under the age of 3. Now, that warning may not necessarily be appropriate for patients undergoing these very small, short procedures that don't require a lot of anesthesia or a lot of time under anesthesia. So, but with that said, I think there's so much we can do in the office now before the age of 3 that, at least in my practice, I'm doing much less general anesthesia for the younger children because I can do so much more in the office setting and do so well with it. But in terms of the side effects of anesthesia, there are always risks from anesthesia. I mean, that is a fact. But in good hands with a pediatric anesthesiologist at a facility where it's done on a regular basis, everything should be fine.
So Susan says, is there anything else for a toddler to take before treatment other than the numbing cream? Do you consider numbing cream a blocker for treatment?
I don't consider numbing cream to be totally perfect in terms of providing anesthesia. Keep in mind that the laser itself provides an anesthetic. There's a cooling spray, a dynamic cooling spray that was actually developed by Dr. Stuart Nelson that all of these machines have. And that cooling spray actually protects the skin, protects the patient from a certain amount of discomfort. That's what it was designed for. Ultimately, we found out that the cooling spray has the ability to allow us to use higher energies safely and protect the skin. So this has been very helpful for treatment. The next generation V-beam that I talked about earlier will also have contact cooling, another way to cool the skin. And with the patients we've done to date so far, many of them found that that was less painful than using the actual spray itself. So it'll be another option in that regard.
It's great. Mandy says her 2-year-old has autism, but does not have Sturge-Weber based on the MRI, and she wants to know how often you see it. I know in my 24, almost 25 years experience, I don't hear of many of these cases. I mean, with Sturge-Weber, we hear of some cognitive problems, but I don't hear of it in general. Do you?
I've not. I mean, I have some patients with port wine stains and autism, but I'm not sure it's on the higher incidence than it would be in the public at large.
Right, in the general population. So Erica says her daughter just had a cherry mole pop up on her face where she has a birthmark. Is this common? We have seen our general doc and have been referred to plastic surgery.
Okay, so this is the thickening that I was talking about a few minutes ago. That can occur in port wine stains, and Scott had a lot of these as he got older. I don't think they need to be excised surgically. I think with the appropriate laser that can be handled. Sometimes they get very, very thick and very raised and they can bleed, and then surgery would be indicated. But I would say we manage 99 out of 100 of these with laser treatment.
That's great. So Erin has a good question. She wants to know about treating where there's hair, and will you lose your hair, whether it's the scalp or eyebrow?
That's a very important question. I generally don't treat in the hair-bearing area, particularly in the children. The very fine hair in the babies and the young kids tends to be lost for a very long period of time. So I avoid treating that altogether, and just advise the families that the hair is going to cover it cosmetically, and we'll deal with any lumps or bumps that come up as the kids get older.
Thank you. So Julie says that her doctor in Atlanta said that maintenance treatment, like once a year, doesn't have any effect on a port wine.
I don't agree. I do think that the maintenance treatments do keep things at bay and will minimize further growth.
So Heather has a good question. Her daughter's 2.5. She's had her daughter's had 16 laser. Her port wine is on her lower lip. It seems like it's not lightening it as much, and it's getting thicker. Should we be lasering her lip? Is there any benefit? She's not sure. So we get a lot of that, Dr. G. Like, at what time do you switch from the laser? Does it become a surgical need over laser?
So it's an important question in the sense that all of these port wine stains are different. You can't categorize them into one bin, so to speak, one box. So there is variability. When you have thickening of a lip like that, or thickening of a cheek, or if you open up the mouth and you see that there's some vascularity on the inside, that suggests there's deeper involvement. And that would also suggest the laser is not going to do as well. The reason is the laser only delivers injury to the blood vessel at millimeter and a half, and sometimes these vessels are much deeper. So when you're talking about thickening of the lower lip like that, then you really have to consider some of the surgical options as well.
Okay.
So laser plus surgery for something like that. Laser is to lighten the top component, but if you want to deal with the deeper component with the lip is thickening, then you're better off with a surgical approach.
Thank you. So Shireen has a good question. She says, how often do you see a port wine stain over a venous malformation? Her daughter's had multiple lasers. She's 9 months, and the port wine has pretty much disappeared. I'm not sure. I guess that would be something you'd have to look at the images,
I think you'd have to see it.
See the pictures.
It just could be part of the same thing.
Right.
What you may have is just a venous malformation with a superficial component.
Right. So you could send your pictures to Dr. Geronemus at birthmark.org/Geronemus, or to myself. Danielle says her 3-month-old daughter has a port wine stain is geographic rather than confluent. I have heard that this often means it'll respond better to treatment. Do you find this to be true?
Not necessarily. I think one of the things we have seen that where there are anatomical differences is based upon the anatomical area. For example, the inner part of the cheek can be a tougher area. Sometimes the outer part of the jaw, where the jawline is involved with the neck, can be more difficult in terms of a response. But that has more of a validity in terms of response than the actual geographical shape.
Well, I think too, she might be responding to the session I did with Dr. Nelson, where he talked about where the stain has a lot of good skin peeking through it, like it's more geographic in that there's white patches that it seems to grab the laser, where the thicker confluent ones require more treatment. And I think that's generally true.
Yeah. But also there are those anatomical
right, the differences. So Dennis Fiorino says hello.
Dennis, where have you been?
He says he's overdue.
Okay.
So you'll see him soon. Laurel says, I messaged you a long time ago, and Dr. Linda, but I never received any. Laurel, message me here and I will get back to you, before I get home on the train. I don't know why, because I always respond, but you can message here or birthmark.org/Dr. Linda or birthmark.org/Dr. Geronemus, or even go through our website and we'll make sure that one of us gets back. We'll both get back to you, I promise. So I don't know what happened on that one. So Jenny Cedric said her daughter is 3 and her port wine faded naturally as she aged, and around 2, it seemed to stay about the same. We've seen 3 doctors and all have said her vessels are small and they don't even see it getting darker or bumpy or raised. It's more pink in color and very marbled looking, but not treating this and her being 3, are we missing precious time in preventing it from probably getting worse?
I think it's important to know where that birthmark is. There's some birthmarks that do fade on their own, particularly in the midline of the face, in the middle of the forehead, sometimes on the nose and the upper lip. Those can fade. If it's one of those, then it's not likely to thicken over time.
Okay. I'm just trying to see if I missed any. Oh, darkening if it is going to. Okay, yeah, she was going to say if it was going to get darker. It's on her cheek. So that was the one who just said that it's okay, faded, but
Sounds like mom.
Yeah.
And my feeling is the more you can get rid of, the less likely you are to see exacerbation or increased vascularity or the darkening or the thickening over time. So our goal is to get as close to 100% as we can. And those patients do have less issues going forward.
So we're waiting for a question to come in, but I have one for Dr. Geronemus. So do you think that Scott's time in the Middle East, the 2 years where he was in chronically exposed to the sun day in, day out, could have an effect?
I do, not to a tremendous degree, because I think this would have happened anyway over time. But what happens, I'll try to make this in layman's terms, but if you have these, in a birthmark like this, you have these enlarged blood vessels. And around each blood vessel are elastic fibers. And as you get older, what happens is those elastic fibers get weaker, so the blood vessels get larger and then become more elevated. One of the things that impacts elastic fibers is sun. That's why people age and their skin gets loose and lax. So your elasticity changes. So the same thing's happening with the blood vessels. So I think the sun does play a role, and we hear this with other conditions as well.
Thank you. Can you laser gums? How do you treat a port wine on the gum?
You could. It has to be done very cautiously and carefully. You don't want to be overly aggressive. You don't want to weaken the ligaments around the gums where the teeth are placed. I haven't really had that request, but it can be done.
Jenny, you can send Dr. Geronemus your pictures at birthmark.org/Geronemus. And remember, everybody, our conference is Saturday, October 6th. And for those that qualify, Dr. Geronemus is doing a free laser treatment. So it is a great opportunity to come and hear talks, meet with other families that have a port wine stain, hear our clinical psychologists, and also get breakfast and lunch included, a hotel. It's limited to the first 50 people who sign up, and we're already close to already filled. So if you'd like this opportunity to also get a free clinic appointment with him and the laser, make sure you sign up at birthmark.org/conference. So that's Shara. So Julie also said, I may have missed this at the beginning, but when did you, Scott, notice your birthmark starting to get darker and thicker?
I would say right around 18, 19 years old. It was still pretty light when I was in high school, and then it was around the same time when I joined the military and I had a lot of sun exposure. So I went through a period where I was doing training in San Antonio, and then I went to my first base for 7 months, and from there I went to the Middle East for 6 months. So I was in Kuwait for 6 months, from March to August, right when it's starting to get, it's progressively hotter every month. And I would say around that time is when it started to get darker. Now, over my 20s, I would say into my later 20s, that's when I started developing the nodules, and it started thickening more. And that's kind of when I was exposed to the birthmark community, you know, as far as social media and stuff. And I started looking into it more and tried to get some research done and, you know, get treatment.
It's a little early.
Yeah, I was going to say, is that a normal
yeah.
course? So
It's a bit early. We do see it,
Mm-hmm.
but typically you don't see that until the 30s or 40s.
That's what I thought.
It can happen.
Right, and maybe the sun exacerbated
absolutely.
it. Yeah,
absolutely.
So Laurel said, I'm being seen by doctors in Columbus, National, and DC for 4 years, and they still don't have the final diagnosis. That Dr. Rubin said it was a port wine and did 2 treatments, but didn't make any difference. We're Asian. But when she resigned, another doctor said it's not, because my daughter has some small red spots all over her body, aside from the one on her mid-forehead down to her nose. When they recommended genetic testing, I have one small red dot on my wrist. They found out that we both have the same RASA1 gene mutation. I'm still waiting for diagnosis, if it's really port wine or something else.
Well, there are lots of different conditions that can lead to vascularity of the skin. So it's possible that it's not a port wine stain. So without seeing it, without having the details, it's hard to know. But that's why being in the hands of someone who understands these things, I think, is important.
Critical. And that whole RASA1 gene is flying all over the World Wide Web, you know, discussions with Birthmarks for testing for it. I don't know that it makes a difference, right? I mean, you have to get it treated, you have to get it treated.
That's right.
Right. So Erica said she wanted to thank Scott for sharing his story. Erica Bloom, I guess you had put it out there, and she said her daughter started out very light at birth. It's on her face and other body areas. Do you think that they are very, do you think that port wines that are very light or faint at birth are less likely to darken and thicken, Dr. G?
I think the ones that are darker at birth are more likely to thicken. But I've seen some light ones as well that actually get darker and thicken.
Like Scott's?
As Scott described, but I think those kids who are born with very dark ones are more likely to see changes in terms of thickening.
So Kelly said that her son's port wine stain is around his cheek, eye area, and head. What precautions do we need to take in the summer? Obviously sunscreen. What do you recommend, and do we need to make sure he wears a hat or any other coverage?
Well, I'm a dermatologist, so I would answer yes anyway to wearing a hat and sunscreen, regardless of the birthmark. So I think one of the things that I'd like to emphasize to families with kids with birthmarks is you want them to live a normal life. You want them to be as comfortable as they can be and not be ostracized and not feel different than everybody else. So you want them outside. You don't want to keep them inside. I know we did this volunteer work in India through this organization. And we had this family come in where the mother was talking about how she never let her kid out of the house. And I said, if you don't do anything at all, let your daughter live a normal life where she gets out and does things. Just take the normal precautions that you should be taking anyway, which would be a sunscreen and a hat.
Right, and that's one of the reasons we love Scott as our ambassador. He surely didn't let it stop him in the military or in getting his real estate license or his MBA.
No, Scott's very social, very outgoing.
Yeah. So
people love him here in this office and elsewhere.
And that's important. So Rebecca says, how far apart should the laser treatments be done on a hemangioma located on the cheek under the eye? We've done one treatment 2 weeks ago, and I can see it's helping.
With hemangiomas, we like to treat every 2 weeks, and the reason during the growth phase. So the growth phase is really from birth, up till 6 to 9 months of age.
Right.
So we treat every 2 weeks. Otherwise, you lose the benefit of the treatment.
This is for you, Scott. She said, does Scott get treatments with or without numbing cream, and how does it feel?
I use the numbing cream, and I would say, it hurts. It feels like a rubber band snap. I would say is the best comparison, and that's what you hear a lot of. So, yeah.
Heidi says that her son has been receiving treatments from a good while, at least 40. He's 13. We aren't seeing any clearance. We're treated from the Midwest to California and see Dr. Nelson 4 to 5 times a year. We love Dr. Nelson and his staff. I know we are hitting those puberty years where I know things can change. What can we expect during these puberty years?
Well, there is a greater risk of some darkening during puberty, particularly with the girls. I think the estrogens have more of an effect than testosterone on the thickening. But perhaps, in your daughter's situation, the newer technology will provide some benefit. You're certainly in excellent hands with Dr. Nelson. He's terrific.
And hi to Lisa Marie Bianchi saying hi to you, Scott. She says you're the man, and she wants to know if you have any sunscreen with you.
Well, it's 30 degrees out here, Lisa, so, we're not in Florida right now, but I make sure I have it on me at all times.
Scott's wrong. There's nothing to do with temperature. There's still sun.
That's right, and I tell the parents that, Dr. G.
Even on a cloudy day.
Yeah, even in England, they need to wear sunscreen. Yep. Natasha, she didn't finish. Her daughter has, and probably just keep going, Natasha. Oh, here we go. Hemangioma on her arm, but has started to ulcerate. When we will laser to be an option, she will be 3 months on March 30th.
So this is one of those situations where propranolol, medical therapy, might be the most effective option. Obviously, I haven't seen it, so I really can't say. There are some doctors who do treat ulcerated hemangiomas with laser. I am not one of them, but I do feel that you should be evaluated with somebody who offers medical therapy in a situation like that. The ulcerations from hemangiomas can be uncomfortable, so it can be tough for these kids.
What do you do with an ulcerated lesion when you see it with treatment?
I make sure they get propranolol and some topical wound care.
So wound care, okay.
And then once it heals, then I begin the laser therapy.
And then Cassie said, is it possible for a laser treatment on the temple that has hair growing from it? Is it possible the treatment could destroy the hair for the hemangioma?
If it's in the scalp, what we have found in treating hemangiomas is that generally the hair comes back.
Oh, that's pretty interesting. So Laura asked another question about the RASA1, and she said, will it affect the diagnosis of port wine versus CM, AVM, which is the new ISFA diagnosis? Is there a reason to do the MRI, genetic testing, or anything? I'm not sure about that.
I don't have any.
Yeah, so that when we have our geneticist on, that'll be a good question. So Jody said she did her last 5 treatments, 76 in total without numbing cream, and I thought I had better results. So.
Better results without the numbing cream.
Right.
I mean, that's a possibility. We did a study years ago that showed that it didn't make a difference. But I think if you have smaller blood vessels, maybe a lighter port wine stain, it's possible that the port wine stains, that numbing cream is actually constricting the vessels, so the laser won't work as well.
Suzanne has a great question, really good one, Suzanne. She has a 20-year-old who has extensive port wine over large parts of her body, including palms of her hands, armpits, 700 zaps. And she wants to know, do you recommend, or would you put her under anesthesia?
It's a very variable thing. You never say never to anything. Such a large area, it could be helpful. One thing you could do undergoing anesthesia is just get a little IV sedation. So rather than getting true general anesthesia, something like one gets when they go for a colonoscopy or a gynecologic procedure, where they just get a little IV sedation and some pain relief, rather than getting true general anesthesia, where one is fully asleep and there are more side effects from that.
Would you also split it up maybe and just do certain sections? Would that be?
If there shouldn't be much pain afterwards. I think for these patients who need multiple treatments, it's very valuable to get these treatments done, as much as you can at one time.
I've heard Dr. Nelson talk about using a nerve block too instead of anesthesia. Is that something you've ever considered?
No, we do nerve blocks all the time.
Oh, okay.
We've done that for Scott periodically.
Oh, good.
So it'd be very helpful on the face in particular.
Yeah. Especially if it's going to be like extensive treatment, then would you recommend?
When I add, let's say, the YAG laser for the nodules that Scott has, the nerve block would be very helpful because that's more painful than the pulse dye laser.
That's good. So Julie said her son's port wine stain is in his entire left side of his face and head. He only had treatments under general before age 2. He's now 4. We have not noticed it darkening yet. Should we just wait until he's older and it starts to darken again and can understand getting treatments without general anesthesia, or should we start doing them again sooner rather than waiting for a change?
I think you're better off treating sooner. Whether he can tolerate procedures in the office or not, I can't say, not knowing your child. But the issues regarding anesthesia in a 4-year-old get around that concern that the FDA had about treating the kids under the age of 3. in a repetitive fashion. So I think you have options there, and they're very personal.
So Cassie just wanted to add, she was the one with the hemangioma near the hairline, just that she's ready to go off of it. It's really had a great result, but there's that little residuum, telangiectasia, and so.
That responds beautifully to
the
laser.
treatment. Yeah. Yes. So the one asking about hair loss, her birthmark goes into her hairline on her temple, and she's never lost any hair there or on her eyebrow.
You're lucky.
Yeah. So Jennifer said her son has had 18 laser surgeries 20 years ago, just starting again. He was put under when little because of seizures, hasn't had seizure in 16 years. Is it okay to not do general?
Yeah, if the patient can tolerate it, I think it's preferable.
Well, I think the seizures, maybe he might have Sturge-Weber, so he should be okay.
We do it all the time.
Okay. All right, so looks like we're closing in. We only have 20 minutes left. So once again, do you need to leave?
Yes.
Okay, so Scott and I are going to finish the last 10 minutes, and Scott will answer your questions. Oh, hi, Jim. Hi, Jim. Jim Murphy. He's saying hi to you, Dr. G. Do you see any promise in the sun illumination research being done at the University of Missouri, or are there more promise with the radio frequency?
Well, I'm always open to new ideas.
Sonal illumination?
Yeah, I'm not familiar with that.
Yeah, Jim, send that information to me so I can share it with Dr. Geronemus and Dr. Nelson, because I'd like to see that myself. Okay, so.
I'll take another question.
All right, so Brooklyn wants to know, is there any harm in waiting a year to get treatment? Her daughter is in maintenance for the last 18 months, but has been getting laser every 6 months. I was thinking of trying to push it out 12 months this year to see what happens, but I don't want to undo everything we've done.
Yeah, I don't see any real issue with that. I think, closer to puberty, you may want to go a little closer together, just to prevent that darkening. Although the downside of doing that, the kids are a little more resistant to treatment at that age. It's a little tougher to get them into the office and become dark.
So before you go, so when someone reaches their maximum clearance, regardless of if they see any changes or not, do you recommend they stay on an annual treatment plan, like at least one treatment?
If we haven't cleared them completely.
If you haven't.
Keep in mind that we have a higher incidence now of patients who are cleared.
Completely cleared.
That's right.
So the ones that are completely cleared, do you just want to see them if there's any
recurrence?
Any recurrence.
Right.
So that, I think that's important. So only come back if there's recurrence, if there's complete clearance. And those who haven't received complete clearance should stay in treatment.
That's correct.
As long as the laser can reach the stain, correct?
All right, it's been my pleasure.
All right, thank you, Dr. G.
Everybody.
And Scott and I will stay and we'll continue to answer your questions. So any questions you have for Scott, very important, the psychosocial issues, of course, living with a port wine stain. He did have the bullying issues, but, he'll tell you himself, he didn't take it lightly. I like that. And he didn't let it stop him. So that's definitely important. And then also, for those of you who are still on and have questions for me, about our conference that's coming up on Saturday, October 6th. Once again, free laser treatments with Dr. Geronemus. It doesn't get any better than that. And we have 50 free hotel rooms for the first 50 people. It's an all-day conference. There's free daycare, breakfast and lunch, psychotherapy sessions, dental exams, orthodontic exam, makeup sessions to see those who have a port wine who've never tried makeup over it. So please make sure you check us out at birthmark.org/conference. And I hope you will come and get and hear the latest information on the diagnosis and treatment of not just port wine stains, but all vascular birthmarks. So let's see if we have any more questions. How old is Scott?
34.
34.
Easy one.
I wish I was 34, Scott. You're lucky. Scott rocks. Hey, Scott, my son has a similar port wine. Any advice for how to build confidence with him? He's only 4.
Well, I mean, obviously I can't think back that far, but I remember being a young kid. And I would just say to just try to treat him as normal as possible. Enroll him in sports, have him in all the different programs, teach him what to say, if kids have a question for him and, those type of things.
And keep it medical. like if he had diabetes, you would tell kids, oh, I have diabetes, that's why I have to take insulin. It's a port wine stain, it's a vascular birthmark. And that sentence alone, most of the kids don't know what it means, so they know that it's something medical, right? And that can dispel the fear and the thing over what is that. It's a vascular birthmark, and I was born with it. And, some kids are born with birthmarks.
And Julie, if you want to direct message me, I have no problem talking to your son, talking to anybody or talking to you guys. And that goes for everybody out here. Right.
So you can reach Scott at birthmark.org/Scott. And he's also on our Global Ambassador page. So Natasha's daughter has siblings who ask what's a nice way of putting it so they are not worried. Asks what it is. So
you're saying when they ask what the birthmark is?
She wants to know what's a nice way of saying what it is. And I think, like we just talked about, saying in a medical way, it's a vascular birthmark. 1 in 10 children are born with one. Right. They can be anywhere. And sometimes when you say that to kids, like when we do the Buddy Booby Readathon to the little kids, some will start saying, oh, look at me, I got this brown spot on my finger, and oh, look, I got a brown spot here, and I got a blue spot here. And I say, they're all birthmark types. So
yeah, whenever anybody asks me about it, of course, if they're not familiar with the vascular birthmark, they'll say, you sure it's a birthmark? I'm like, it's a birthmark. I was born with it. I lived my whole life with it,
Yep.
So.
Yes, and Al beats yes, definitely lymphatic malformations, venous malformations, arteriovenous, cutis mammarata, port wine, hemangiomas. The top experts in the world will be here. If you have a lymphatic malformation, you'll be seeing Dr. Weiner for free. You'll have a clinic appointment with him, and you'll hear his talks on the latest in diagnosis and treatment of lymphatic malformations. So remember to sign up early. So that's birthmark.org/conference. Or you can go to our website at birthmark.org. Kelly wants to know of what brand's sunscreen do you recommend and any ingredients to look for or avoid.
I have to I really just get, what I generally do is I get like children's sunscreen. So I'll get the highest, block as possible, and I'll just make sure that I get the spray so it's just easy to apply real quick.
Dr. Nelson uses the Eucerin 100 SPF. It's 100%. It doesn't get any better than 100%. So Julie said Levi is proud of his birthmark. How do I explain getting treatments to him? That's really important because a lot of parents say we're building their confidence to love themselves with their birthmark, and then we're telling them they have to get it treated. And the way you say it to him is, there's nothing wrong with your birthmark, but as you get older, it can change. And so we're going to treat it now so that it doesn't get darker. It doesn't become a problem for you when you get older. And you can say a lot of things get worse as we get older, and that's true. So it's not a fear thing, but rather an aging thing.
Yeah, going back to that, you hear the question, treat or not to treat. You want to you hear a lot of the time some parents want to say they want the child to be involved in the decision. And I kind of touched on it earlier on in the video. When I was 12 years old and my father asked me if I wanted to get it treated, the only thing that I could really think about is, it's going to be a different kind of, or a new kind of different now, right? Instead of just having a birthmark, now I got a birthmark with, scabs, and, it's going to scab for 2 weeks or whatever. And I'm going to have to, have it repetitive. I would say that, those things, a 12-year-old or a 4-year-old or a 6-year-old, they're not really prepared to answer those kind of questions, right? Or they don't really know how to deal with it. So I would just, to Linda's point, just try to explain it to them like, it could get worse. We want to make sure we're taking care of it, that kind of thing.
Right. And like a lot of kids wear glasses now that are younger because they want to correct their vision. And that's what I would say to some people too, is, well, we need to get laser now to correct it, just as if kids would wear glasses to correct their vision. It is a medical condition just like the others. It's just that when it's on the face primarily, which 85% are on the face, the head and neck area, it's first thing people see is the face. It's like a cleft palate. When people see a cleft palate, they know what that is, and they know child's got to get treatment for it. And we're raising awareness now that birthmarks are birthmarks, and some need treatment and some don't need treatment, but we propose early intervention and treatment so that the kids don't have to deal with the psychosocial, the thickening, and the blebs. And like Dr. G said, upwards of 3/4 can have the blebs and the thickening, and that's why we recommend for everyone to try to get early aggressive treatment. Heather says, hi, Scott, Heather Funk. I appreciate you sharing your story. My daughter is only 2.5, but we are just starting to get the why does she have dots or what's on her face at daycare. It's good to hear ways to explain it and how to help her handle it through the years. Also, my hubby is SFS too.
So, it's funny. We should have Jody on here making a comment how she tells, how they deal with Megan or whatever as far as the polka dots. But I would just say, just like you, to your point about the glasses or any different type of medical condition, just kind of explain to them, this is what's going on. They're getting the treatments for the birthmark, and it's temporary and it'll fade in about a week, and it is what it is. And shout out to your husband, Security Forces. I got 14 years Security Forces. I've been doing the first sergeant thing for the last 2 years. So
woo, high up to you, Scott. Thank you for serving. Debbie says her granddaughter is 22. A hemangioma grew about 4 months, protruded. No hair grows on it. It's the size of a small egg. It's gone down about half, but it has a red center and clear around it. Pediatrician keeps saying it's no problem. What advice? Okay, so Deborah, by the way you spelled pediatrician, I can tell you're from the United Kingdom. And so in the United Kingdom and Europe primarily is very far behind the U.S. in treatment. We are having a conference June 29th and 30th in Italy, and there'll be a free clinic there. If you want to message me, I will be posting about that between now and Monday, where those sessions will be. Also, send your picture of your daughter, and I can send it to Dr. Wayner. He's in Berlin, and he can tell you about what the options would be, because it's hard to say. If it's going down already at 22 months, it may be a rapid regressor and not need anything. It just may be completely gone, because for it to be going down as much as you say by 22 months, that's pretty good, because a lot of them don't go down until they're like 8, 9 years old. So you can message me. Jody says, any chance for glaucoma specialist? Yes, of course. We have Dr. Kane, who is a glaucoma specialist that will be at the conference. We have Dr. Comey, who's a Sturge-Weber expert, and we have Dr. Pinto from Harvard. So, Jody, we have 3 Sturge-Weber syndrome experts coming this year. Big shout out. Alicia Hall, somehow I just came upon this. Are these birthmarks only on the face, head, and neck? My daughter has a big vascular birthmark on her stomach. She's had it since birth and has grown as she has grown. So, all of these video sessions, this is our 12th one, are on our page at birthmark.org or facebook.com/Vascular Birthmarks Foundation /. And you can view them all. Now, no, port wine stains and any vascular birthmark can be anywhere from the head to toe, inside and out. The one that's on your daughter's stomach and it's been growing with her, that's typically a port wine stain, but it can also be a different type of cutaneous stain. So Alicia, send me a picture of it at birthmark.org /Dr. Linda, because I'd like to see what kind of a stain it is and get a good close-up picture of it. And also, let me see, how old is she? Did she say? No, you didn't say how old she is. So let me know how old she is and when you send that, because if she's in puberty, which can start anywhere from 9 and up, and it's changing, then this means it's a hormone-sensitive vascular birthmark. Thank you so much. You're welcome. It's from you, probably for you, Scott. It's on the back of her head. Okay, I'm not remembering that, but how to treat gum hypertrophy. Dr. Darrow is our gum expert. You can reach him on our website and email him at birthmark.org /Darrow, DARROW. He will be at our conference in New York City in October, doing free dental exams and orthodontic exams. And those free exams are obviously for the patients that have the port wine. And we do makeup sessions for the patients that have port wine. And the moms sign up thinking they're going to get a free dental exam and a free makeup session, but it's really for the patients so that we can help you as a parent or a loved one of someone with a birthmark, get some treatment and get some options. Hello from Israel, Orit. Thank you so much for tuning in. And you can go back and view this whole video. Dr. Geronemus and Scott our global ambassador, answered some great questions. And any of you still listening, interested in being a global ambassador for VBF, the purpose is to establish a network of people all over the world that can speak for us, because we can't get out there. And when we have new guidelines on treatment, when we have Facebook Live sessions, when we have our annual Put on Your Birthmark campaign, Scott and I are just launching our anti-bullying pledge, and the next week you'll see that go viral. We want this network of ambassadors to also share it within their group. So please message Scott or email him at birthmark.org/Scott, and you can read about our ambassador program on our website at birthmark.org/ambassador, I think, right? Correct, Scott? Yep. So great. We'll see you, Jody. I haven't seen you in a long time, so I look forward to seeing you at the conference. Oh, so 16 years. So yes. So Alicia, 16 years, peak of puberty, changes can be occurring, darkening, thickening, maybe complaining that she feels it more. Do talk to me, though, not that this is a decision at this point, but with truncal vascular birthmarks in females, there's a caution against ever going on birth control, because the birth control makes the blood vessels dilate and can cause these to act up even more. So email me the picture, let me take a look at it, and we can chat some more. And she just posted .org, Dr. Linda. Remind me what hypertrophy is. So hypertrophy is thickening. So if a hypertrophy of the cheek, you'll see a lot of people that their cheek will be swollen, their lip will be larger, the gums will be swollen out beyond the teeth. If their port wine is on their upper eyelid, their eyelid will get thicker. So hypertrophy means the expanding, hypertrophic of the tissue. And it can be, it's primarily is the face, but limbs can expand, and digits and arms as well. You're welcome, Alicia. So we see more. So let's see, how many minutes do we have left? We have
4 minutes.
4 minutes. Questions for Scott or myself. Once again, we have our conference on Saturday, October 6th at the Lenox Hill Hospital in New York City. All the top docs in the world will be there, our experts, Dr. Wayner, Dr. Rosen for extremity lesions, Dr. Wayner for lymphatic malformations, Dr. O for facial nerves, Dr. Kane for glaucoma for Sturge-Weber. We have Dr. Comey for Sturge-Weber. We have Dr. Delphinian for KTS, Dr. Nelson and Dr. Geronemus on the latest in lasers. We have psychotherapist Leslie Graff, who'll be talking about the psychosocial implications. Lots of wonderful sessions, a full day of activities, free daycare, breakfast and lunch. We want you to get accurate information. That's why my philosophy for 24 years has been no one asks to have a child with a birth defect. No one asks to have a child with a port wine stain or a hemangioma. So why would we, make you pay crazy amounts of money to get this information? We want you to have the accurate information so you can make the best decision for your child and yourself. So yet when you sign up for the conference, you will see the 7 clinic teams, Julie, and you'll see who's on them. But other than that, I look at every single picture of every birthmark, and I make sure myself that they get to the right appointments. And your daughter or son could be seen by 4 doctors on that day. If I think you need to see a Sturge-Weber expert, a laser expert, a glaucoma expert, I will give you an appointment with all of them. You will not leave unless you see all the doctors you need to see. And we have typically 150 appointments that day. You just joined in. You can go back and watch this again. Is there a registry of specialists? Yes, at our website, birthmark.org. Up at the top, you'll see Find a Doctor. It's a button. Click on that button, and you will see vascular birthmark experts throughout the world. So that's for you, Kim. Thank you, Julie. Tara, yes, and thank you, Scott. She says you're an inspiration. So we have 2 minutes left. Happy to take any of your questions. Once again, please join our VBF Ambassador Program. Coming up in May. May is Vascular Birthmarks Awareness Month. We were able to get a congressional resolution done 12 years ago declaring May as the VBF Vascular Birthmark Awareness Month, and we want to raise awareness all over the world about early intervention and early treatment. I will be in Italy with a conference and clinic in June 28th and 29th. I'll be posting about that. I'll be in California next month with Dr. Nelson, so we'll be available then. And I'll be posting the VBF on the move schedule, where I will be with experts throughout the year to have informal meetings with any families. We did it in Texas a few weeks ago, and it worked out great. Okay, so Alexandra says your daughter has a port wine on her head. Most of it is in her hair. A part is near her ear. We've been advised to wait until she's about 5. And that would, no. So, no, Timolol is not for a port wine stain. Timolol is for a hemangioma. Alexandra, you need to message me, because our laser experts believe in starting treatment at 2 weeks of age, so that you can be done by the time your child's 1 and they don't have to go through it. It gets traumatic when they get older, but tell me where you are and send me a picture. So it's birthmark.org/Dr. Linda, and I can get you into an expert. Some use anesthesia, some don't. That's going to be up to you. I mean, again, at 5, it can be traumatic, but a lot of patients come to Dr. Geronemus and get laser treatment at 3, 4, 5, 6, and never have anesthesia because the parents don't want the anesthesia. But she should get treatment now and not delay. Oh, she's 8 months now. Sorry, Alexandra. You should start now. So send me her picture, and I will let you know who is the closest expert to you. Come to the conference in the fall and get a free laser treatment for her with Dr. Geronemus, and you'll know. Another thank you from Julie. What age? You have memory noticing you had a birthmark. So when did you realize you had a birthmark?
I mean, as far back as I can remember, I knew that I had a birthmark. I mean, I can remember some very faint stuff when I was like 5 or 6 going fishing and stuff and going camping with my father. But yeah, I can remember all the way back to
So it was always a part of you,
Mm-hmm.
right? And you just knew you had it.
Yes.
So, I mean, Diana, you say you have no sign that your son knows it. I don't think it's an issue. As long as he doesn't notice it, it's a part of him, just like if he has blue eyes or blonde hair, right,
Yeah,
Scott?
I would say once he gets to school and the kids start talking and they ask him questions, then he'll start noticing those kind of things.
So we have a couple representatives in the Middle East. By the Middle East, we have a Dr. Tanous, who is in, I believe she's in Iran. If you want to email me, Ahmad, I can tell you where she is. We don't have an extensive group. We do have a pretty decent sized one in Israel. So just email me at birthmark.org/Dr. Linda. Dr. Linda. Okay, your son is 9 and is getting angry some days about his lymphovenous malformation, which includes pain. What can I say to help him be happy? You know what? I would suggest that you contact Leslie Graff, our clinical psychologist. She's on our website at birthmark.org/Graff, Graff. She's wonderful with providing families with dialogue that you can have with your son. And if you're in the area, or if you can make it to our conference, she has sessions with the kids and sessions with the parents, and it'll be really wonderful. Also, I would hope Anis Melody, that you're with a good treatment specialist for this, to manage this. So let me know, who you're seeing, because you may need another option. Great. So if you're coming to the U.S. this spring, Ahmad, I will get you free consults. Okay. So message me, give me your schedule. I will get you free consult with Dr. Geronemus or Dr. Weiner, especially if you're traveling from the Middle East. And if it's for a port wine, I can even get you a free laser treatment. So make sure you get a hold of me and give me plenty of time. So we are signing off. Ooh, what happened? I guess I signed off today. Oh, so we're still here. I'd like to thank you all for joining us, and thank you, Scott, for being here. Yeah. And you can go back and watch this, and we're going to end our broadcast. Thank you all. God bless you, and enjoy the spring that's coming next week.
Thanks, guys.